Hello and welcome to this live of every Wednesday at 7:30. I hope you all are doing very well. And today's topic is going to be about parental support and investment during the therapy sessions. So we're going to talk a little bit about the importance of the parent's role during therapy session, or how they can help, how exactly they could be, more participating during therapy sessions. But first, let me explain you and introduce myself. Obviously, my name is Lisa. I am an occupational therapist and I work with children with special needs. I have been working now for over 10 years with children with different ages and disabilities. And through these years, I have the experience of observing different benefits or different experience with parents inside of the sessions and parents who are not participating during the therapy sessions. And today I would like to focus this topic because I think it's a very important one. Now, I know that some of my followers or most of my followers are parents, and most of you reach out to me because of some of my videos, or maybe some of the videos that I did already before. They were interesting for you, and this is the reason why you would like to know more. Now, just a reminder, every Wednesday I connect here on this platform to talk a little bit about different topics. And this Wednesday, it's about parent support. Okay, if you would like to see the other videos that I did, obviously I'm inviting you. They are always in my YouTube channel. I also will be more than happy, and I appreciate if you follow not just the YouTube channel, but also my social media and Facebook and Instagram. So yeah, well, that's a little bit about me. Like I said, I am an occupational therapist specialized in PAL1 therapy, and I love oral motor skills. So most of you who saw me is because of the videos of me saying the importance of oral motor benefits and how important it is to work on different oral motor skills. Last week it was a very interesting one. I shared the video. We stayed like 1 hour here, so that was very nice. We spoke a little bit about my personal experience with children with autism and different protocols and diets. And in particular one, we were talking about the NEMCheck protocol, which I definitely suggest you to have a look and to check and to see how does it work, what are the benefits from it, etc., etc. So, like I said, today it's about parents and parent support and parents' involvement. Now we're going to start with a little bit of idea, of what is the role, how important is to have the parents inside of the sessions, when to have them and when not. Like I said before, in my therapy sessions, many times parents are staying inside of the therapy room. So I will be doing the therapy lesson, and we will be working on different things, and the parents will stay inside of the therapy room. Well, that's okay, depends on the child and depends obviously on what are the needs, what are the benefits. You have children who are behaving very well with parents, and on the contrary, you have children who display different behavior issues because the parents are inside of the session. So here my little suggestion to all of you parents, and obviously therapists as well, who are like watching these videos and checking around what exactly Lisa Deuti is saying, and also see for yourself if it does work for you or not. My suggestion is that every time that you are involving the parents in your therapy session, sorry, Lion, I don't speak, I guess, German, or I don't know which language is that, so apologies for that. Unless if you can translate me in English, I will be able to help you out. For those therapists who work only with the child one-to-one, I will say that it's a great approach and it's an interesting approach, but sometimes we are missing the part of involving the parents inside of the therapy session, because you have to understand that the child is coming, let's say, to your clinic or to your sessions once in a week or twice in a week, but then that kid goes home and the child needs to be still involved in playing, involved in interacting, involved in, fine motor skills, gross motor skills, etc. Sometimes it's very interesting to make parents participate during our therapy sessions, because they will be able to see and to learn what we are doing, or the way how we are addressing the child, the way how we are talking to the kid, the way how we are managing stressful situations. And then after that, we can actually train the parents and help them to continue collaborating and cooperating at home. The same goes for schools, childcares, every place that where the child spends more therapy than in the therapy room with the therapist, let's say in this case with me, it's always way more productive and beneficial for you to train or to involve yourself in a multidisciplinary approach and multidisciplinary team, working together, because you make sure that the child is getting the best out of it, right? I'm sorry, but I don't know what's that mean, and it's not the topic. I'm sorry about that. I'm not going to be able to answer your question, because I am an occupational therapist and I work about children with special needs, and this is the topic today. A little bit, it's about how the importance of involving parents. So my lives goes always to therapists and parents, or future parents, or future therapists, okay, or anyone who is working in the medical field. Suhail Khan, hi, hello. What are we discussing about? Well, basically, welcome to the channel. Basically, every Wednesday I connect here to talk about different topics. I'm an occupational therapist. I work with children with special needs, and today's topic is about the importance of involving parents during the therapy sessions. How to do that, why to do that, and how exactly it's going to help the child to actually get better. So this is a little bit of I will say particular life. So if you're not interested, I'm sorry for that, but if you're interested, put a like, subscribe, and follow. Okay, so like I was saying before, it's important for you to understand when to involve the parents in the therapy sessions and when not. Okay, if the parent is disturbing the therapy session, let's say the parents start, giving instructions to the kid. Hey, come on, let's go, follow, do this, do that. Obviously, it displays, I will say, a negative impact. Okay, sometimes I will leave a couple of sessions to parents to see how they behave, to see how the child is behaving, for me to observe, because it's important, right? And then I will take my decision if the best choice actually is to keep the parents with the session, or we can tell them that no, thank you very much, and it's better that you stay outside, and that's all. If not, maybe we can teach the parents how actually behave during the therapy room. Sometimes you will have grandparents coming, you will have, the auntie, the uncle, and they obviously want the child to succeed in all the activities because, hey, come on, you can do it, you're super good, you can jump, you can catch the ball, that's very good. But let's not forget that it's still a therapy approach. We are doing therapy. You are not coming here just to spend the time. So it's very important that we always communicate with the parents, and at the same time we make them understand. Like I said, I don't always do it like in the first or second session. I always give a little bit of time to understand my parents, right? It's obviously that's how it is. The parents are understanding me, they are learning how I work, I see and observe my client, and at the same time the parent. Great topic. I appreciate your effort. Thank you. Thank you very much. So, the parental support for me, it's very important. I don't mind to work in the therapy session with the parents at all. For me, it's great. For me, it's perfect. They are learning. They are maybe catching some of the ideas that I'm trying to show to the kid, and at the same time, they can actually represent that at home. When it's become problematic, like I said before, it's when actually the parents are starting putting themselves too much inside of the therapy room, and actually this is disturbing the kid, and or the parents are remaining calm and they are being there, just supportive, and that's it. But the child starts displaying behavior issues, crying more, hitting, or having, tantrums out of nowhere, want an excessive attention to show papa, mama what I'm doing, or the grandparents, to share, their emotions, which is cute, depends on the activity, but sometimes it can be disturbing, and obviously sometimes it can take you very long in order for you to achieve the goal that you want to achieve, right? Because there is always the good grandparents, the bad grandparents, the good side of papa, mama, and the bad one. So when they are maybe with Miss Lisa, they are trying to behave different with the parents, etc. And then there is the other area when it happens a lot, at least to me, when I will be having kids inside of the therapy room, and they will be behaving completely different than at home. They will be behaving completely different on other things, no? Yes, this is basically the topic. The topic is about the importance of how the parents have to be behaving, not behaving, support, if the parents can be supported during therapy sessions or not, Mr. NMT. So this is a little bit my explanation. The idea is obviously not just to give you a couple of tips and that's it. It's to share obviously my experience with you, because I don't know who is watching me, and if I have a parent or a therapist, I want to make sure that I give the appropriate information, right? So it's important to also, when you're introducing the parents during therapy room and inside of the therapy room, it's important that you explain clearly what is an occupational therapy role. So we are not talking about just mama, papa, look what I'm doing, this I'm playing with this or that. It's also to understand, to show them. We have fireworks in case if you hear them. It's to also explain the role of occupational therapy. It's very important. So they know exactly where they are coming, for which purpose they are coming, and what we are doing about it, what we are working, what is the interest of coming to occupational therapy, and how exactly we are going to work, what we are doing, how we are helping the child, etc., etc. It's important to highlight also the importance of collaborating with the school and the childcare. So for example, like I said before in the introduction, I will be constantly co-working with childcares and schools in order for me to obtain the maximum information. Sometimes, not sometimes, most of the time, the children have a speech therapist, an occupational therapist, a physiotherapist, an ABA therapist, etc., etc. The more you connect with the other therapists, the best for the child. Because the idea is obviously to do this great teamwork, no? That you understand your kid, you understand your client, and you want to actually help him. So if the child is doing extracurriculum activities, where he is going, what he's doing, how he's doing, etc., etc. Not because you want to know what the child is doing, in like 24/7, but mostly because maybe there are certain changes that can also interfere in your therapy approach. The another thing that I wanted to talk, it's a little bit the understanding the therapy process. So sometimes the parents are like coming for the consultation and they will be confused. I'm coming here for 1 month, 2 months, 1 year. I'm doing 5 sessions, 10 sessions. And I try to always explain this. I personally, but this is me, my personal experience and obviously the way how I see the things, I never work on a program of certain sessions. Okay, the reason why, and I know many occupational therapists works with that. The reason why, because I see as a therapy as an extra help that the child needs in their life. Now, it's not like always for a long term, but we have to fight to make sure that everybody understands that therapy is not a game. It is not you come and you will be fixed. Because sometimes you have this misconception, right? I will come for the therapy for 2 months because this is the amount of sessions that the therapist gave me, and then I will go and I will be fine. In some children, this works because they have something punctual to work on. Pencil grip, sitting tolerance, maybe build up a little bit of body awareness, some sensory, some touching the food, etc. But most of the time, in my experience, the kid comes like with a big backpack. And when you start opening the backpack, you start having like sensory issues here, fine motor skills here, not brushing the teeth, not be able to wear a hat, no using sandals, no showering because the water, and there is like a crazy amount of things, communication. So we cannot be covering everything. You always have to stop, build up a good base, and build up. And then is when you start building up. So it's important that the parents understand the role of occupational therapy and understand the process of therapy. It's not just like this. I go to therapy because to have fun and because my child needs a little bit of activity extra. That is a very particular scenario for a particular child. Most of the kids, they will need of a long-term rehabilitation in order to achieve many other areas that are not there, due to autism, due to ADHD, due to dyspraxia, due to neurological condition, sensory processing disorder, whatever. But there is always not more than one aspect to work on. So this is super important. Regular communication with therapists, that's another point that I wanted to see. And like I said before, it's important to communicate with your therapist. And if you are in a team, working in a team, it's not only one therapist taking care of the child in your clinic, for example. It's important that you work together, you communicate together. If you are the only one working, but you know that there is a speech therapist, there is this, you always collaborate together, which is also very important, okay? Parents should communicate first, I think. Yes, of course. You mean parents communicating with the therapist or parents communicating with the child? Because then you have this, you have always, obviously the parents should be on the top always, okay? Always the first ones. But sometimes with the child, yes, of course. The first thing is the parents with the kid, for sure. We need to make sure to build up that good relation. But you will be surprised that many times I have parents who are not, I don't know how to put it, they find it difficult actually to interact and to connect with the child because maybe they don't know how to, they have a toy or a couple of toys and they just think that, okay, if I buy the toy, I put it in front of the kid will play. But many times we need to physically be involved with the child in order for the kid actually be active. And this nowadays with the lifestyle that we are having, everything it's in a rush, etc. It's very difficult sometimes to connect parents inside with the child and actually then build up this communication, like I said before, with the parents, with the therapist, with everybody. But yes, definitely. So regular communication with therapists, it's very, very important. Also, don't forget to ask. Don't forget to ask questions. If you are doing a therapy session and you are not understanding something, ask the therapist. If the childcare tells you, listen, he's biting a lot, ask some questions. When he's biting, how is happening? What shall I do about it? Do you have a recommendation number of a therapist who could help me? Blah, blah, blah. All of this, it's very important. Questions are very important. Don't just go home with a lot of things. Even if you go to home with a lot of stuff, write down what you want to ask in the next session or send a message or an email to the therapist, Try to be as much as possible active in this therapeutic process because that will help your kid 100%. Dyslexia child has to handle with care. Yes, well, not only dyslexia, most of the kids who has disability and difficulties, they need to be handled with care. But at the same time, we have to make sure that we know what we are doing, how we are doing, and why we are doing. And many times, you will be surprised that some therapists are doing stuff without knowing why we are doing it. So it's very, very important to point out our aim, our goal, our objective, whatever you're targeting, but to make sure that you know what you're doing. So that's fantastic. So I would like to mention some practical ways. I would like to mention some practical ways to support therapy at home. So, for example, first, it's creating a supportive environment. So it's very important that we can create a supportive environment. We have to make sure that maybe the house need to be a little bit rearranged. I don't know, maybe we need to have a calming area in case if the child is displaying difficulties with behavior. Maybe we can have, his room a little bit more open and, organized in order for him to actually play with different toys and not to play always with the same one and very repetitive. So this is very important. Sometimes we need to organize a little bit our environment at home in order to provide a more safe and productive way of actually for the child to continue reinforcing his skills at home. Incorporating therapy activities into daily life. For example, we could be using during feeding some fine motor skills. Feeding ourselves, putting the food on the table, cooking. While we are cooking, maybe involve our kid during the cooking. Obviously, this I'm talking in general, but we try to always make sure that we come with a great logic on the activity that I'm thinking if for my child is adaptable or not. So if I'm thinking about cooking a pizza, but my child has difficulties with the fine motor skills, there is no point for you to work on pizza. Maybe we can work on something else, okay? So incorporating, for example, like I said, cooking, maybe fine motor skills or some social interaction, communication, eye contact, attention, sitting tolerance in different activities. While playing, while waiting, while sitting, while putting or removing the shoes, etc., etc. I said that it's very important that the child becomes independent as soon as possible. You want the kid to be independent. Because many times the goals are, I want my child to talk, I want my child to walk, I want my child to be able to write and color. But the idea general of therapy, at least how I always try to explain and focus, is that your child, right now it's a 2 years old, 3 years old, 4 years old, in 5, 10 years is going to be completely different kid. So you for sure what he will or she will need, it's independent skills. To be able to go to the toilet, to be able to shower, to be able to brush their teeth, to be able to put on the shoes, to be able to go to school, to be able to sit, whatever. So those are like very big general independent skills that we need. And then obviously we can specify in other things. But we always have to have the mindset that we are working from therapy point of view. We work for the kid to be independent, okay? Independently what you're doing. But the child will learn catching and throwing because like this he can independently participate in a sportive activity, for example. Or his eye-hand coordination will improve, so then later on he will be able to pay better attention at school and be able to recognize different colleagues at school, or maybe have abilities to pay attention to small details, etc., etc. The next point is positive reinforcement and encouragement. So, like I said, not always children are okay with working extra. So going for therapy, it's already it's already not for everybody. It's a fun situation. So we need to encourage the kids within the with positive reinforcement to continue working at home, maybe while cleaning up, maybe with some reward charts, maybe finding a way where it can be interesting for the kid, but at the same time he's learning or she's learning. So it's not all about I have to do it because my therapist told me. It's because I really understand what the therapist is working on. I really like those objectives, and I will try to make it fun at home, or as much as possible encouraging, and we will try to get the best out of it. Use visual aids and tools. Actually, for children who has difficulties with communication, visuals are super good. I have a lot of different type of visuals where we just laminate them, we print them, we cut them, we put them around the room, and we are going to brushing the teeth, and there is step by step how to brush your teeth. You're going to the toilet, and there is maybe on the wall, step by step, what is going on when we go to the toilet, etc., etc. You're cooking a pizza, or you're cooking a sandwich, you're making a sandwich, whatever. Maybe you can put some visuals step by step of how to prepare the pizza, or what we need to do in order to make a sandwich. So the kid don't have just to listen blah 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 to you, but also visuals, and visuals are more interesting. You can also find videos. Nowadays there is a lot of videos in YouTube channels and everywhere where actually they can help, and they can be easier for the child to imitate, which is fantastic. You are making him participate in an activity, and you are working on his or her imitation. I'm listening to you. You made some great points. Thank you very much. Thank you. Much appreciated. Don't forget to like, subscribe. I always try to put it there because it means a lot for me. So thank you very much. So this is another thing. Dealing with challenges. Dealing with challenges, it's complicated because in therapy we need to have these two roles, very important. Consistency, which I will say not for everybody. It's a skill that you need to acquire with the time, okay? It's not something that you become an occupational therapist, you say, I will be consistent and persistent. But consistency and persistency is something that we need to so being persistent and being patient, those two, consistent and patient, are super important. Patient, not everybody is patient with therapy room, and not everybody is patient to see your child misbehaving or whatever, or the therapist being a little bit more hands-on and maybe more disciplined with him or her, etc. So patience is something that we need to build up. Patience when the child is crying during 1 hour, patience when the child is maybe shouting on you, at you, or maybe hurting you, or patience when the child is basically just doesn't want to do what you're asking. And we need still to be patient, and we need to be observative, and we need to understand why the child doesn't want to do what you are asking him, and see how we do about it. What I'm doing wrong, how can I go about it, right? So patience is one, and consistency is super important. Persistence, consistency, anyway, because we have to make sure that we are always going toward the goal. You know the amount of times that I repeat the same activities? A lot. And not because I want them, it's because I know that our nerve system is built up by repetition. When we say, my child doesn't imitate, imitation is repetition. It's basically you take a movement and you do it again and again and again and again. For you to imitate what I'm saying, how I am moving, or whatever, smiling, facial expressions, I need to imitate that movement once and another and another and another time. So we cannot just say, we have to work on imitation. We have to work on coping skills. Well, a great tool, it's first you need to get your patience and your consistency. What are you doing? So make sure that you're consistent in your therapy. Then make sure that as a parent you are patient and you let the child to show you what they know, what not. And step by step, day by day, week by week, month by month, we will get there. We will get there, I'm sure about it. Managing stress and self-care. This is a little bit goes for you to, make sure that you take care of yourself. Parents, therapists, anyone who is listening to me, okay? At the beginning when I started, and I really like my job, otherwise I will not be doing what I'm doing 24/7, so that's for sure. Because there is a misconception in occupational therapy that we are doing this because, besides doing what we are doing because we like, there is no other way, because it's not a job that where you can become a millionaire. It's not a job that you are going to be super mega rich. It's not a job that you can be traveling around the world. It's a job that you are taking care of another person constantly, and you are putting from yourself a lot of energy, a lot of time, a lot of thinking. I go home, I'm still thinking about my clients, if something happened, if something didn't, what I can do, how can I be better, etc., etc. It's a constant work. When actually other jobs, it's not like that. So when you're a therapist, independently, occupational therapist, doesn't matter which therapist, but you are working on these fields, you have to make sure that you're good, that you are trained, that you exercise, that you do some hobbies, that you are having some free time for yourself, because otherwise it's a burnout. It's a burnout therapy. It's a therapeutic field, I will say. When I started at the beginning, I was very happy, and I was working a lot of hours because I wanted to get better and so on. But there were a moment that I literally had 1 year where I didn't want to do any therapy at all. I didn't want to go back to work. I didn't want to continue working. I didn't want to hear any other, new case, because it was too much. I was working a lot as well, and at the same time I was really, very much like confused in all of this. But I just realized that I actually need to also take care of myself as a therapist. And the reason why I'm telling you this is because I want you to make sure that you have your hobbies, that you have your time, that you have your dedication for other things that you like. Don't forget, therapy is one thing, your job is one thing, but at the same time exists you. So try to take care of yourself. As a parent, it's important that also, in case if you see that you're not managing, you're getting stressed, you're not managing what the therapist recommended you to do at home, it's okay. Talk with another maybe professional, maybe to have a psychologist on the side, maybe talk with your therapist. Say, listen, the recommendation that you gave me are not working. I'm not really following up. It's not really easy for me. I am not managing to do it. It's okay, We all have a momentum where we go outside of this. We need to go outside of this repetitive thing, and sometimes when something becomes too much, it's too much. But it's important to take care of yourself, and it's important to make sure to understand what you're doing. That's why at the beginning I told you that when you're in therapy, it's important that you understand which therapy you're doing and for which reason you're doing it, because it's very, very, very easy to get exhausted. Very easy. It's a therapy where, like I said before, any therapy, occupational therapy, speech therapy, we are giving a lot and we are having expectations after that. So it's important that you take care of yourself. And in case if you are having some stress situations, you also take care of that, because it's super important. The better we are, the better we can also do our job or as a parent, as a therapist, or anyone else. Okay, so it's super important. For example, other thing that I wanted to see is like connecting with other parents and resources, support networking, etc. Many parents, for example, they are constantly doing, some extra courses, checking groups of other parents, etc. It helps a lot. And especially if you have maybe like little group where parents can talk and support each other in case of there are difficulties or whatever. This is also super important and something that helps to pass through the therapy. Like I said before, I don't see therapy as something that you start, and you just you start and in 2 weeks you are ready and that's it. Most of the time it doesn't happen like that. We don't discharge kids straight away. But once we understand why we are going for therapy, what we are doing in therapy room, and for what is the purpose, I think this is when we can actually clarify and make sure that our goals are successful and we are going towards the same goal, towards the same aim. So, yes, well, basically, that was the topic for today about parents, about supporting the parents, about making to see how actually the parents can be collaborating during therapy sessions and when maybe they shouldn't. Okay, but again, this is therapy intervention. What can work for now, it might not work in 1 or 2 months. So you have to always reevaluate, check around, etc. Slowly. You always have to see what works for you, what's working for the child, and see how you're working that with the therapist. In general, I just would like to, enclose this live, saying that for me, in my personal opinion, I love working with parents. I think it's a great support. At the end of the end, they are the one who will be facing the child's difficulties on a daily basis. So more we help we can do and provide, the better. Okay. So I am thankful for those who connected with me today. I'm thank you for those who had some comments and stuff and give some points as well. I always invite you to rewatch the other videos. Every Wednesday at 7:30 I connect, so you can watch them and you can see them and comment them. Or if you have any questions, you can always write. And in the meantime, I wish you a very good Wednesday. I will be seeing you the next Wednesday at 7:30 with a new topic, new field. If you have any questions or you would like me to talk in something particular, write me, okay? On social media, here, under the videos, whatever, okay? So in the meantime, thank you very much for watching and see you.